Hi folks, my name is Paddy Hogg. I'm a councillor in North Lanarkshire and I'm doing a public appeal to the Scottish Government to ask them to look into and reassess all of the peer-reviewed evidence on the subject of electromagnetic field radiation that comes from devices we use on a daily basis, such as mobile phones, laptops linked to Wi-Fi itself, the masts that emit radiation, and also cordless phones. There's been a tendency for most people to assume that all of these devices are safe. The regulator IRCNIP, that's the International Commission for Non-Ionising Radiation Protection, and Public Health England keep telling Westminster Government and anyone who wants to check this out that everything is safe. There is no issue from this. The regulator IRCNIP tested a dummy in 1998, many years ago, and all they did was test for thermal heating and decided it isn't heating it up, therefore it's safe. There is no correlation whatsoever between a test like that and potential health effects on human beings. What the leading scientists in the world are telling us is that IRCNIP serve industry, they do not serve public health. And they have written what's called the EMF call. The EMF call was written to the United Nations, the WHO, and it was an appeal to lower standards and to ignore IRCNIP because there is no correlation with public health. And I'm asking the Scottish Government to look at the EMF call and look at 10,000 peer-reviewed science papers written by the best experts in this field, because they're telling us and emphasising that illnesses and disease, cancer and deaths are being caused by our inappropriate use, addictive use quite often, of these devices on a regular basis at home, at work. Since 1998, the most ubiquitous toxin in our environment is electromagnetic radiation or radio frequency radiation. The evidence is showing now that radio frequency radiation should be a class 1 carcinogen. 3 major studies happened in the last few years. The Hardell study in Sweden proved 2 different types of cancer from low-level ionising radiation. That was followed by the Ramazzini Institute study in Italy with the same outcomes. Radio frequency radiation causes 2 different types of cancer. They used the large antenna at distance and monitored the low-level radiation from them, and the same results as Hardell. This was followed by a huge study in America, the National Toxicology Program, $25 million research study by the government itself, and once again the same outcomes, 2 different types of tumours, cancerous tumours being caused by low-level ionising radiation from these types of devices. So the evidence is there. 10,000 peer-reviewed articles showing harm, recent research showing the class 1 carcinogen status of radio frequency radiation, and we know from a very large report which looked at up to 5,000 peer-reviewed studies called the Bioinitiative Report that harm begins at human cells, on human cells, at 30 microwatts per square metre. Much, much lower, manifoldly lower than the level set by the so-called regulator, the independent group in Europe, IRCNIP. So we know from the science that there is considerable harm being caused. If you're using a phone up to your ear, close to your ear, at least for half an hour per day for up to 10 years, your chances of a glioma brain tumour are doubled. If you're using it for hours on a daily basis, then it's going to be a shorter period by which your likelihood of getting the glioblastoma brain tumour is likely to occur. And there are many other ways in which harm is being done. If you're using a laptop on your knee, as I used to, but stopped once I learned the science, what you're doing is you're irradiating. So if your laptop is picking up Wi-Fi signals from your Wi-Fi router in your house, what is happening is that you're irradiating your pancreas, you're irradiating your liver, and you're also irradiating your private parts, so there's going to be an effect on fertility, and you're going to cause something quite similar to sticky blood. It's the process that's described as rouleau process, where the blood starts to clump together and get as if it's sticky blood. This will contribute to cardiovascular issues. What I want to go on just now and do is show the 8 mechanisms of harm explained by a leading expert called Martin Pall. Martin Pall has listed 8 mechanisms of harm. 1, lowered fertility. 2, neurological effects. 3, cellular DNA damage, that's 1 and 2 strand damage. 4, cellular apoptosis. 5, oxidative stress and free radical damage. Oxidative stress has got a cascade where it leads to other damage as well. Endocrine and hormonal disruptive effects. And then 7, intracellular calcium gate ionizing effects. What that basically means is that the effect of pulsing radiation coming towards your body forces the cells, when they're being vibrated, to force too much calcium into the cells, and too much calcium into the cells causes damage, and once again a cascade of things can happen. If that's a fetus growing in the womb of a pregnant woman, it can contribute considerably to the chances of the baby being born with autism. At the other spectrum, the calcium gate ionizing effects can contribute considerably to the potential for Alzheimer's. So the effects on the brain, neurological effects, are considerable, and the damage is being done now with 3G and 4G. The final mechanism of harm listed by Professor Pall is obviously cancers. And if you're using the phone near your head, there can be 2 or 3 different types of cancers that can occur there. If you're using your laptop on your knees, that can contribute to other types of cancer as well. And of course, cancers can lead to death. So what we basically know now is that radio frequency radiation is a class 1 carcinogen from the best evidence, and wrong use through us not knowing we can be harmed, continuous use, even putting your mobile phone switched on data into your pocket, in your trousers, will irradiate that area considerably. Put it into your jacket pocket near your heart, and there might be, you're risking cardiovascular issues. So there are many ways by which we can be harmed, and what I'm appealing to the Scottish Government to do is to put out a TV-based advertising campaign to advise people how to use the tech devices safely. Kids are getting addicted to the use of these devices. And we know from the science that children, particularly under 10, absorb 10 times more radiation into their skulls because the bones are thicker. So we need to protect children, and we need to protect pregnant women. I'll go on to make some mention of the potential damage coming from the rollout of 5G. 5G involves what's called millimeter waves, and we know from the science, looking at things like Wi-Fi, that Wi-Fi employs 5-inch waves, 5-inch radio waves, or microwaves. So the 5-inch waves are pulsing, and it's the pulsation that causes the damage. So it's the pulsation coming at the speed of 2.45 gigahertz, and that causes the damage, and the shorter the waves, the more damage it causes. So the waves coming from your mast at 4G might be 15 to 17 inches long. So Wi-Fi in the house, Wi-Fi in the schools is actually causing more damage than the masts. Wi-Fi in the schools should be taken out if you know what the scientists are telling us. There have been campaigns in various places. Cyprus has taken it out. No Wi-Fi in the schools. France has had the sense to get rid of Wi-Fi in nursery and primary schools. I called upon North Lanarkshire to get Wi-Fi out of the schools, and that sadly was voted down because most of my colleagues weren't aware of the seriousness of the science and the harm that is being caused. So I'm asking the Scottish Government to look into the best science we have, the independent science from the leading world experts, and take some action. If we roll out 5G without being millimetre waves, the likelihood from the best science we know is that it will cause considerable damage. It is going to cause an awful lot more damage than is being caused now. And Professor Paul made the point that rolling out 5G must be one of the craziest ideas in the history of the world. I'm asking the Scottish Government to look at the evidence, reassess the situation, set up our own regulator, and give out public advice to help save lives, lower the tax cost in the NHS, because no one has looked into the damage being done and the costs from this while we are addicted to using these wonderful pieces of technology. But we should be using them safer to cut the cost to the NHS and look after our healths. For the sake of the children being born, for the sake of the pregnant women, and for the sake of the kids at school, I appeal to the Scottish Government and all decision makers to look into this evidence, and let's do it the Scottish way. Let's make the people first, industry second. Thank you.